Now, today we'll be discussing about these X-rays. There are total three X-rays. This is the first, second, and third. All the X-rays are in chest X-ray anterior-posterior. Uh, and in this also we can see these findings very well. That is the reason why we are discussing this thing. Now, when we see there's this one and two, these first and second X-ray, they are from different patients. These are not of the same patient. These are two different patients, and this is totally different patient. That is third patient. Now, what we can notice that this vertical distance looks so much in both this X-ray, and it is much compared to lesser in this X-ray. So that in short tells us that the lungs are kind of hyperinflated, or lungs are much more inflated. That is the reason why these uh, upper and lower lung borders, they are distinctly far apart. How can we label, or how can we objectify this is by presence of the posterior, or we can count the posterior or anterior ribs. Now when we start counting, this is the first rib, this is the second, this is obviously posterior rib, this is third rib, fourth, fifth, sixth, seventh, eighth, ninth, and this is the 10th rib that we can see. This is the posterior rib. And here also same, this is first rib, second, third, fourth, fifth, sixth, seventh, eighth, ninth, and 10th. So up to 10th ribs we can see above this diaphragm, whereas here this is the first rib, this is second, this is third, this is fourth, fifth, sixth, seventh, eighth. So here we are seeing ninth rib, which is not completely, it is almost touching the diaphragm. Here it is, the ninth rib is completely above the diaphragm, and tenth rib we cannot see. In short, we cannot see two ribs in here because these lung is more of a normal, whereas in this X-ray we can see ninth as well as 10th posterior rib as well, because because these lungs are hyperinflated because of the emphysema. Because in emphysema we have chronic irreversible damage to the alveoli units. That is the reason why lungs become so much hyperinflated. We have other proofs also for that. Other things are, like when we see, these are the rib margins, and this is the rib margin, we can hardly notice any fat. See, this is fat. This radio density is of all fat. But here we can see that there is no fat. There is all bone here. We can directly see that these are all bones. There is no fat at all. In here also, we can see that these are all bones. There is hardly any fat. This is all fat. This is axillary fat. So the fat is not here, and this is mostly because of the chronic disease itself. The emphysema is a component of COPD where there is chronic obstructive pulmonary disease. There is chronic inflammation, which simply cause significant weight loss, significant fat loss over a period of time. That is the reason why these patients may lose complete fat. But whereas this, see, this is the rib margin, and what we can see, a very large area of fat. So this is more of a healthy fat because there is no inflammation in this patient. That is the reason why this fat is preserved. The fat is not lost, and in both this X-ray there is significant loss of fat because of the chronic inflammation. So presence of this hyperinflation, presence of more anterior as well as posterior ribs, which can very be well visualized on the X-ray, definitely tells us that this is emphysema. Other things which are very important is this tubular heart. Just see the heart. Because of the significant hyperinflammation of these lungs simply compress our mediastinum and as well as heart. That is the reason why this mediastinum or and heart, they appear more of a tubular. They are more of a complete straight. So here also it is the same. The mediastinum and the heart is more of in a tubular form. It is all in tubular form. Whereas compare this, the heart appears more of a typical globular, and it has its own space, own a typical good space in the mediastinum. So here the heart is not like tubular, or the mediastinum is not tubular. The heart has typical right atrial border, left ventricular border, but in here the heart is more of a compressed because of extensive hyperinflation of the lungs. So presence of tubular heart is one of the sign that patient may have emphysema. And the fourth, one of the most important factor is this is hyperinflation of lung can be uh, objectified by the more is the air, more is the hyperinflation, it will simply cause flattening of this diaphragm. Now we know that the right-sided dome is higher than left-sided dome, and why we call it as a dome of diaphragm, because dome should have a convex round margin. This should be like this. This structure is called dome because it is round or kind of semicircular uh, shape. But in here this is lost. In here this is more of a flat. This diaphragm dome is not of a dome shape, it is more of a flat shape. So this is almost flat, this is almost flat. Here also it is almost flat, and this is also almost flat. This flatness is all because of hyperinflation of this emphysema. Here the dome is very well preserved, there is no flatness. Here also the dome is very well preserved, there is no flatness. So presence of this very well visualized anterior as well as posterior ribs, especially more than the normal X-ray. Presence of tubular heart, tubular mediastinal shadow. Presence of increase inter-rib distance. This inter-rib distance will be increased because of the hyperinflation of the lungs, and presence of flat diaphragm. They highly suggest that this is emphysema. That's for all today. Thank you.